Hello, and welcome to this episode of Elimination Exchange, a podcast series hosted by the Global Institute for Disease Elimination. I'm Jackline Kiarie, and I'm your host for this episode, where we will be speaking about equity in global health, which I think many of our listeners and viewers may know is a topic that's very much at the forefront of discussions today in global health and development. And I'm really pleased to be joined today by Jackline Kiarie from Amref. And Jackie, I'll turn it over to you to introduce yourself. Welcome. It's such a pleasure to have you.
Thank you so much, Priya, and good morning, good afternoon, everyone. My name is Jackline Kiarie, like Priya has said. I work for Amref Health Africa, based in Nairobi, Kenya, and I have a strong background in public health and do quite a bit of work in sub-Saharan Africa.
So, Jackie, you lead the Director of Programs at the Capacity Institute at Amref Health Africa. I'm wondering if you could tell us a little bit about, from your perspective, what is global health equity and why is it so important in these discussions that we're having?
Extremely, extremely important, because I think for a very long time, we've been trying to ensure that we can address the most pressing of health problems that we have here in Africa. But I think with time, we are seeing more and more. Just this week, we've had monkeypox being declared as one of those public health conditions of continental importance by Africa CDC as well as WHO. So the burden is increasing. We have our usual infectious diseases, TB, malaria, HIV. We have the maternal health issues that we've been dealing with for quite a long time. We have the health security issues. I think it's now common knowledge that Africa is reporting about 150 health security issues on the continent annually. So with all these pressing, competing priorities on the continent, then the question of equity becomes a bit more important. It's something that we have to address to ensure that we can keep our populations healthy, not just address the disease conditions, but even just ensure that they stay healthy to really avoid these health conditions. So it's about ensuring that everyone can access health, that we can stay healthy irrespective of your social economic status, irrespective of where you live, that we can keep our populations healthy, and as needed, be able to address any health issues that come up in a timely manner, in a quality manner.
Amref does quite a lot in health equity and really trying to ensure that we're building on this discourse and trying to break down, I think, a little bit between the global north, global south, and ensure that people where the diseases are endemic are actually leading in so much of this. So I'm wondering if you could talk a little bit around some of the work that you're doing here in the space of global health equity and some of the initiatives that you have.
I think first of all here at Amref, more specifically where I'm working at, which is at the Institute of Capacity Development, really we are very concerned about the quality of healthcare workers that we have. We just want to ensure that, for one, our healthcare workers are ready. Like I said, I think most of the priority previously has been around maternal and child health issues. We have the infectious diseases, but the threats are increasing by the day. So the first thing we want to ensure is that our training institutions can churn out healthcare workers that are ready to address this increasing problem. So we have a lot of focus on ensuring we have quality health workers, that we have the right quantities, that our training institutions can actually prepare them and have them market ready. I think that's the first thing. We're also having a lot of work around general health systems, strengthening the infrastructure bits, just ensuring that we have the right supplies, the right commodities, the right leadership and governance with our institutions. I think we have a lot of focus on ensuring that we have a lot of enough sufficient funds being dedicated to the health sector, but how these funds are managed remains a priority. And therefore, the question remains around how do we ensure that we have proper leadership, proper management, proper governance in our health system to just ensure that the limited resources can be used well. So a lot of work ensuring that we have strong health systems, strong governance, and more recently, even working with other national and regional stakeholders to ensure that we can move the local manufacturing agenda forward, because that is going to go a long way in ensuring that we have self-reliance. Right now, we're talking about monkeypox. It's been pressing for the last 2 years, but every time we have a health threat, then there's the call to international partners to see how they can assist. So it's about time that even we as local stakeholders look at how we can do internally within us, within the resources that are available, what partnerships we need to have to ensure that we are ready, we have the right supplies, the right commodities for when these health threats occur, just like the monkeypox we're dealing with right now. So a lot of work around ensuring our communities are strong, our healthcare workers are good, that the health systems can support the health needs, and then, of course, that we can move the health security agenda forward.
You spoke a little bit about this, but I'm wondering if you could expand a bit on the fact that a lot of the barriers to care and equitable care lie outside of the health system. And so, what are some ways perhaps that we can look at addressing those, perhaps the social determinants of health or the environmental factors that play such a role on health inequities?
Really good question, Priya. And I say that because we've realized that the call that we've had for a very long time is about dedicating 15% of our GDP to health. But it's very clear that 15% of a chicken cannot be compared to 15% of an elephant when you compare, how much is being used in Europe per capita on health versus what we are using here in Africa, which means that if we wait until people are sick to address the health issues, then that might be very late, which calls for us looking outside the health system, which is where the social determinants of health come in. For a very long time, we've been able to see the impact that education, for example, has had on girls. For example, we've seen that the girls who drop out of school, that's why we have the earliest, teenage pregnancies. They're the same girls who will not be able to take their children who will not be able to attend the antenatal care as required, will not be able to follow through on the immunization program scheduled for their children, and therefore keeping girls in school means we're able to address so many other health indicators later on along the way. So sectors such as education become very critical. Sectors such as water, sanitation, become very critical because that's the only way we're able to put aside to deal with diarrheal diseases even at the community level. So I say your question is important because it's about time we started focusing on keeping people healthy by investing in sectors such as education, investing in water and sanitation, investing even in agriculture. If you remember what happened during COVID, the people who had the non-communicable diseases such as diabetes and hypertension had worse health outcomes compared to those that did not have. That means our focus right now should be around keeping people healthy, ensuring that we can reduce the NCDs as much as possible and manage them whenever they occur. So a lot of investment also in agriculture, in nutrition that our people are having at the household levels.
I think there's two aspects there that I'm really thinking about. One, of course, the gender component and the inequities that women and girls face that are exacerbated by climate change. And we're seeing that so much. And then also this element that you brought up during COVID-19 of people with pre-existing conditions and the NCDs being more susceptible to the very stark effects and very dire impacts of COVID. So I'm wondering if you could expand on this, especially the gender component, because I think that's something that we're starting to see more and more when we talk global health equity. We need to distill it down to this gender lens in order to actually drive progress.
Thanks, Priya, and a very timely question because we're already seeing the impact of climate on disease, especially the infectious diseases that we have. So when I think about malaria, for example, the spread of malaria has been exacerbated because of the change in the warmer climates that we are experiencing. More malaria incidence means that the woman has to spend a lot more time going to the health facility to take her child for treatment, including herself. Because malaria affects everybody. Spending more time seeking healthcare means that she has a loss of livelihood because then she doesn't have enough time to go and spend on economic activities. A lack of economic power for the woman means that she cannot manage her household duties. She cannot ensure that her family has a balanced diet, that she cannot ensure her child goes to school, for example. So it's a whole cycle of, related events. Just because of one trigger, it affects the health status of her family. It affects her ability to go and look for work, the amount of money she has to spend on her household, the amount of time she has to go looking for safe drinking water because the rivers are going to dry up, the amount of money she will need to use to switch to alternative sources of energy, because now we are talking about gas fuel, for example, as opposed to the firewood, which is really obviously a good switch because it also has an impact on her health status, but what is required to support her to switch to that. So the impact is huge. And I think the biggest question to all of us now is how are we ensuring that the local communities are prepared for this? We've had a lot of conversation on this at the COPs, but the greatest question is around how do we ensure that this information trickles down to the national level, from the national to the community level, because right now what most countries have done, if you look around, we have the climate change adaptation strategies and policies, but exactly how those are going to translate to actual action at the community level is still wanting. And I say that because we did not have, there's obviously limited resources in most of the African countries that we are working in. We have limited resources to a point where most governments are not able to dedicate the 15% that is required for health expenditure. And right now we are asking for more. We are saying that we need to be adapting to the climate change. So exactly how are we going to make that happen? How we are going to ensure that our communities are prepared for that? How do we ensure that our policies translate to action? How do we ensure that the global instruments are being translated for ease of use at the country level? So a lot of questions remain. How do we ensure that there's domestic resourcing for that? How do we ensure there's international support for that? But ultimately, the action is going to be at the community level. And until we have proper mechanisms of ensuring that that happens, then it's going to remain as just global rhetoric or regional conversations without actual action at the community level.
And thinking about some of those last mile communities who are so often left in the margins or forgotten because it's too hard to reach them, or the ROI, the return on investment and cost is too high for what might be at global numbers be considered a relatively low number of cases. But when we're thinking global health equity, it means that every last person should be reached, no matter how hard it is to reach them. And so wondering, what are some of the approaches that you might consider when trying to reach those so-called last mile communities and ensuring, again, that each person in the community is equipped for to live the best healthy life they can in the context?
I think the first thing we have to do is ensuring that people stay healthy, right? That our children are fully immunized, that we are preventing the non-communicable diseases as much as possible. And how do we do that? Ensuring that there's proper health promotion at the community level. There's proper community engagement at the community level. And the way it is set up here in Africa is that most of the time we rely on the community health workers. So how can we ensure that our community health workers are empowered to prevent disease? That's one. I know a lot of programs that we have at the community level are disease specific. So we have malaria programming, we have TB programming, we have HIV, we have some that are addressing the NCDs, which becomes increased burden for the community health worker. And this is a person whom we are not able to compensate adequately. So one, let's empower the community health worker by ensuring that they have the right education. Let's take an integrated approach in the way we are doing our work at the community level to just make it easier for them. Because when we integrate them, we're able to ensure that our resources go further. Instead of one program coming specific on malaria, how can we ensure that we can pool these resources and be able to empower the community health worker on all the diseases that are affecting, all the conditions that are affecting our communities, and that they can be able to address all the areas to ensure that our communities stay healthy, that the children can be immunized, that we have proper diet and things like that we have proper water and sanitation at the community level. So integration is the way to go. And integration is not going to be the responsibility of just we actors at the local level, the community health workers, the district managers, the national stakeholders, but everybody involved in this industry. And I say this because most of these disease-specific kind of response activities, interventions, are mainly in the development sector. Because when you think about the Ministry of Health addresses all the health issues in an integrated manner. But the push from the development sector is what has made this even worse. And therefore, it's a conversation we need to have as all actors to just look at how we can make this integration possible. With COVID, I think one of the major learnings is that we had a lot of investment coming in for COVID. And this investment would have gone further by benefiting the other aspects that we deal with in the health system. So instead of always reflecting after we have dealt with something vertically, we know the way to do things. So how can we think about that more proactively and just ensure that the resources that are being dedicated enable us to approach things in an integrated manner? So, and let's empower community health workers. let's focus on health promotion, because when we keep people healthy, then we leave the health system to deal with the things that, are more complicated and reduce the burden on the health system. And then let's take an integrated approach in the way we look at things, because in that way we're able to ensure that the limited resources are able to go further.
Absolutely. And I think that integrated approach from a delivery standpoint is also recognizes that a person experiences multiple risk factors at the same time. They don't just one day experience a risk for malaria and then the next day experience a risk for high blood pressure. It's all happening at the same time. So to visit multiple providers or have multiple interactions with the healthcare system is just not realistic. But I think to wrap things up, wondering what your take is on a more equitable future for the African continent in the next 5, 10, 15 years, and what will it take to achieve that?
Thank you. Really, that's a really good question, Priya. And I say this because a perfect, equitable future for me would be a future where we're able to keep our populations healthy. So I think for me, equity for me would mean that our populations can stay healthy. And how do we ensure that our populations are healthy, ensuring that there is proper health promotion happening at the community level, that we have proper community engagement at the community level to ensure that our community members know when they should be going for the immunization, how to have a proper diet, how to ensure that we have clean water in the household, proper water sanitation at the household. And we have structured our health system in a manner how we have, in a way how we have our community health workers do most of the community empowerment at the community level. And therefore, that would mean that a lot of investment for our community health workers to ensure that they have that knowledge, the knowledge they need to keep our populations healthy, that our populations are empowered enough to be able to make the right decisions. Investing in the community health workers would mean that we are training them on the right things, the health issues affecting our community, the emerging health issues. I think we've all heard about the health security issues affecting our communities, that they are aware, that they can support in the surveillance efforts, that we can be able to report anytime there's a threat at the community level. And therefore, investing in our community health workers becomes very important. Investing in health promotion becomes very important. One of the challenges we've had around that is a lot of vertical programming, even at the community level, such that this week we have somebody coming to train our community health workers on malaria, and the next week we have somebody coming in for TB. The following week we have someone coming in for HIV, diabetes, you name it. And therefore, taking an integrated approach would be the next thing we'll have to focus on to ensure that it's easier for everybody. Because once the community health worker goes to the household, then they're really looking at the health of the pregnant mother. Is she attending her ANC as required? Is the child immunized? Is the older person living with a non-communicable diseases, and are they managing that as they should? So it's a whole combination of issues that you could find in a household. And therefore, when the community health worker goes to the household, they approach things in an integrated manner, not on a vertical manner as we like to train them. And therefore, integrating the way we train them, the way we support our community health workers would be a really good way of looking at things to ensure that our communities are fully supported. Integration would mean that our policies speak to that at the national level, because those are the same policies that we cascade to the lower level. So our policies need to approach things in an integrated manner. The discussions we are having with our partners, whether it's locally, national, regional, global levels, need to also be integrated. And therefore, a big question arises around how we make sure that there's integration at all the different levels in the kind of conversations that we are having, that we have the right platforms to even have these conversations. And then, of course, the third thing we expect out of those conversations is increased investment, whether that is through domestic financing or international support. And with the increased investment comes a greater need for accountability. And therefore, how do we ensure that there's that level of accountability, that what we commit to actually comes through, that what we commit to and comes through is actually spent well, because there's limited resources, and therefore we have to ensure that this can be able to benefit as many people as possible at the health system, at the community level, to keep the populations healthy. So I think those four things, let's ensure that our communities are healthy for a start, because that is going to reduce the burden on the health system. Then let's ensure that our community health workers are supported to provide that kind of health promotion, community engagement work at the community level. Let's ensure that there's integration in the way we approach things at the different levels. And then, of course, let's also ensure that there's proper accountability, because that's the only way we ensure that our resources can be able to benefit as many as possible. And then we'll have a perfect world.
Perfect. I love that. As they say here, we're invited today, inshallah. So we can only hope that we see this. Thank you so much. Really great discussion and a lot of great food for thought. So thank you so much. It's been a pleasure to have you with us.
Thank you so much, Priya.